afternoon, good evening. Dr. Unati here, your host. Thank you so much for joining us. Today is a Friday. It's a beautiful day in Calgary, Canada. And I'm just hoping everybody is having a wonderful week. Of course, it's a weekend now. Weekend has started for some people. Today, we're going to talk about one of my favorite topics. I'm excited about my colleague here, my friend, who's going to come and teach us what we need to do to look after our skin. As you can see, she's looking all lovely there. Dr. Yinka, you look amazing. I love it.
Thank you so much. Thank you for having me. Such a pleasure.
I'm excited to have this conversation with you. You know what? Dr. Yinka is a colleague. Dr. Yinka Akindeko, she works out of Halifax, Nova Scotia in Canada. She's a family physician and aesthetics doctor. As you can see, she looks amazing. She looks after her skin today. She's going to teach us how to look after ours. Thank you so much for joining us, sis.
Thank you so much. Thank you for having me.
I'm glad. I'm happy you took time to join us here. Today, our topic is acne and hyperpigmentation in black skin. You know, skin is quite an interesting organ. It's the largest organ in our body. You know, we sometimes don't realize how important it is to look after it because it regulates our temperature. It has to be good looking in terms of looking after it because it has so much to offer for us. Today, Dr. Yinka is going to teach us on how to identify things that we need to pay attention to so that we can get the help we need. Dr. Yinka, why did you choose aesthetics?
Aesthetics chose me.
Really? Tell us about that.
So aesthetics chose me. So when I finished my GP training in England, one of the sessions I had was with my trainer, and I think it was part of the training for him to open up the world of medicine to me. Like, these are the other options of things you can do as well as family medicine. So he talked about lots of things. He even talked about hypnotherapy. I remember that we talked about hypnotherapy. He told me how the sessions went. And then he talked about aesthetics. So it felt like everything he said was not clicking. But when he said aesthetics, and I was like, oh, okay, that's something that sounds interesting. And that's how I started. So at the time, he was talking about Botox and fillers and injections, like more non-surgical inputs. He didn't talk about skincare. But so I went for training and got into the training and did the training. And then when I finished, all my patients wanted to talk about skincare. So you would inject them with Botox and they'll be like, but I need to sort out my skin, doc. And then I started learning about skincare. I started learning, and I found that there was a really, really big need for our community. There was not really a lot of scientifically backed skincare products out there for us. And that's how I got into skincare in itself.
I love it. You know what, Doc? You're saying that because recently I had a friend who was struggling with a lot of hyperpigmentation and also hirsutism, like a lot of excessive hair. And she was struggling to get to any medical spa that was okay for her black skin. Because lasers are okay out there, but not many are okay for black skin. You know what? I don't want to waste your time because I know this is your favorite topic. So tell me, what are the causes of acne in black skin?
Yeah. So acne in itself is extremely common. It's the commonest skincare condition in the world. Like, it affects every skin type. And we think mostly that it's a bit of hormonal, or mostly hormonal, because it's rare to have acne in children, especially the kind of acne we're talking about. We're talking about acne vulgaris. So it's rare to have that in children. It's usually at puberty, when you're becoming very vain and conscious of how you look, then this horrible thing pops up, to dent your confidence.
Yes, yes. You know what? I'm glad you're mentioning confidence because the little kids I see, like the teenagers that I see, they always complain about, I don't feel confident. My self-esteem is affected by the acne. So I'm glad that you are out there making a difference because it can make a huge impact on any child growing because I mean they're already struggling with their hormones and now the skin, which is our presentation to the world, right?
Yes.
Awesome. So in
Yeah.
your practice, tell me, what do you see mostly? What's the most common condition you see in black skin?
So the commonest complaint in black skin is hyperpigmentation,
Right.
because that affects us. Even people that never develop acne seem to still develop hyperpigmentation, which is dark patches. So it's very common that you get like dark patches around, places like that, or if you scratch your skin, you have dark patches. I remember once going to a child abuse talk, and they were putting up these pictures and putting up these pictures. What's this? What do you think this is? And they put the picture of this little black boy that had these dark patches on his legs all over. And people were saying, "Oh, this is cigarettes, stub abuse." And I said, "It's mosquito bites." This is essentially how black skin responds to injury. This is how we love to respond. Our skin just loves hyperpigmentation, just loves to respond to black patches. And this guy was, "Oh, okay, you're the only one that got him." I said it was very funny, like, because I know I grew up around this. So this is by far the commonest complaint, hyperpigmentation. Yeah.
Right, right. I mean, we see hyperpigmentation in pregnancy too. I had it too when I was pregnant. The neck was dark, and of course, my tummy area. So, how do you treat that?
So melasma, the one that you see in pregnancy, is also, there are other things that can cause it. So things like the birth control pills. Some people develop that as well from that, and is the hardest cause of hyperpigmentation to treat, because it goes across all the layers of the skin. Very difficult to treat, but it's possible. You will need a combination of lots of things. You will need topical products. You probably need some laser. Some people are using oral medications. They're using medications like tranexamic acid. So there are some studies showing that tranexamic acid can make a difference. So you probably need a lot of combination of treatment options to get benefit with melasma. It can be really difficult to treat, and even sometimes it comes back. So it can be that kind of lifelong battle to get it under control.
Awesome. Yes. So about acne, sometimes I struggle to get it clear. For my young and older patients, I have to eventually refer them to dermatologists. What options people have when they have acne? And of course, I guess depends on the lesions themselves, how they present.
Yes. So with acne, it's better to treat early. When I said that the black skin loves these dark patches. So dark skin loves to scar. That's its favorite thing to do. So you want to treat it early. So even with the teenagers, when they start, you can start with things like salicylic acid wash, which you can get over the counter. Salicylic acid will help with the inflammation. It will help to break down the comedones. It will help to dry out the skin, because oiliness is part of the problem. So you can start with that. There are also some glycolic acid washes. The DYS range, we've got glycolic acid wash. So you can start from that. And you can take away things that can aggravate it. You know how we love coconut oil? It's not good for acne.
I know, yes, we love that. Really? Yeah. I didn't know that.
It's not good for acne because
so now
it plugs up all the pores and aggravates it.
Okay. Right. Now that you're mentioning dietary stuff, tell me more about what foods would trigger acne. Because I know that sometimes we hear people say, don't eat lots of chocolates. Is there any relation, really, any medically proven stuff around that?
So when we were in medical school, I'm sure it's probably about the same time, maybe we went to medical school around the same time, I don't know, I'm guessing. There was lots of teaching at the time saying diet does not affect acne, right? But you would hear people that would swear. I had someone call me a few days ago telling me, I know peanuts trigger my acne. I know, it's like clockwork. So patients have been telling us this for a while.
Right.
Food triggers the acne. So now there are few studies actually confirming that things like dairy, we're not sure if it's the hormones that go in the dairy, because remember they inject these cows with hormones. So we don't know if it's the hormones that go in dairy that triggers it. But we know that some dairy, people tend to, it's been shown that dairy can trigger acne. So I will always listen when a patient says to me, these foods trigger it. Then, you know your body best. Yes. You're the expert of your body. Right. So I would say, yes, then avoid it if you can. Yeah.
Of course, yes. It's interesting you mentioning that, because I see it also in people who would say, I have dermatitis. It was triggered by the peanut butter, the peanuts. I noticed that when I take it away, my skin clears it. And then, do you also want to mention something about how also babies, when they breastfeed from their breast, could they also get some changes in their skin?
So I haven't seen the studies for that, if breastfeeding, but I know that what the moms eat goes in the breast milk.
Right.
So
yes, I'm saying that because in plastic, I've seen eczema. Right. Go ahead, sis.
So some patients that have like cow's milk protein allergy that is quite severe, you have to speak to moms about breastfeeding and what they eat as well, because what you eat goes through to your baby. So you have to treat moms sometimes if they have got allergies. Right. Yeah.
Awesome. Thank you so much. So tell me, you are just mentioning that at your skin line company, what do you use mostly, and what have been the results when you see? Do you have the before and after pictures? Because people will want to see what exactly you're talking about. Would it help them, and how do you define this skin line would be appropriate for certain skin? What goes through that?
Okay, so I do have before and after pictures. As a doctor, I'm very careful, probably a bit more careful than I should be about publishing people's photos. So I ask for permission, and if there's any bit of reservation, I'm like, I'm not sure, So I do have that. Also, remember that these products are scientifically backed ingredients. So, for example, retinol has been around for decades. We've got tons of research saying retinol is good for you, and this is what retinol does. Sunscreen, I have sunscreen in my range. We know that you need to protect your skin from sun damage. It's an SPF 50, so is a protective. It's got enough factor in there to protect you from sun damage. The vitamin C serum is a 20% vitamin C serum, highly active, does a great job. I'll tell you a funny thing that happened with me and my product. So because now I've moved to Canada and the products are manufactured in the UK, I ran out.
Oh my gosh, sorry about that.
For myself, for my skin. And I still had some, but one of the things I ran out of was the vitamin C serum. And while I was waiting for that, I could see my skin, the glow, some of it was going away. And I grabbed a few other products that I could see over the counter. I thought, oh, maybe this has got some vitamin C. They claim it's got vitamin C, but I was really struggling. I could see the dark patches coming back. And then the products arrived. And I started using my serum. I was holding her like, oh my goodness, I missed you so much. I missed you so much.
Yes,
I could see the difference even on my skin. And I know.
Yes.
But I could see the difference on my skin. So I'm like, oh gosh, this is so good. It's been so long.
You know what, Dr. Yinka, there's something you mentioned, the sunscreen. Coming from South Africa, you are from Nigeria. It's hot in Africa. I don't remember growing up applying it. And you know what? I know of few colleagues that complaint of these damaged skin changes? Because I guess with all our childhood playing out in the sun, do you want to say something about that? Because truly, I've never used the sunscreen in my childhood. It's only when I was older, actually, I became more conscious of it when I came here.
Yeah. So there's a lot of, do I need sunscreen if I'm black skin? Do I need sunscreen? And we know that the melanin protects you from sun damage. Melanin offers about sun protection factor of 13 to 15, right? Depending on some a little bit less, some a little bit more. The most conservative dermatology colleges in the world tell you to use at least a 30. So you're missing out a sun protection of at least 17 when you don't use that.
Really? Yes.
And then you wonder why, why you get the dark patches. You have to, the melanin is not strong enough. No one on the planet is stronger than the sun. It's been around before you. When you're gone.
Of course.
So we need that extra protection. That's one. Okay. Two, there's a picture on the internet, so anyone can look it up. It's about this set of twins where one tilled the land, so she worked in the farms, and one worked in the kitchen or something like that, worked in-house. They're twins, you can see they're identical twins, but still the one that tilled the land had aged quicker, just from years of being exposed to sun damage. And so even just that difference of being outdoors all the time, indoors, that makes a difference. The third complaint I hear is the sunscreen leaves me looking ashen and gray. It doesn't suit my skin type. And this is what I try to address with DYS and SPF. It doesn't leave you looking ashen. It doesn't leave you looking gray. It blends in beautifully to your skin. I used it today. I use it every day. And so that complaint is taken care of.
I love it. Now, you know what? I don't want to forget this. When we grow up, people always say, start taking care of your skin the minute you hit 30. How does that work? Because some people, they want to wait till they're 40 to do the cleansing. Do you want to talk about that? Because honestly, when I hit 30, I was very conscious of, I need to make sure. I was already doing that, but there's this magic number, 30, and the skincare.
So there's no magic number. Remember when we started that we talked about acne, and that when they hit teenage or when they hit puberty, the spots start coming out. So why are you not treating at that time? Is there an age to start protecting yourself from the sun? Right. So we would have Caucasian parents, applying sun protection on the children. I remember when I first moved to England and they used to say, oh, send your child in the summer with sunscreen, So those children are already looking after their skin. So it might not be, you might not need all the products in the world, but sun protection starts from childhood. When acne hits, you do that. If you have dry skin, you moisturize and you hydrate your skin. When you start seeing hyperpigmentation, you treat it. So skincare is from zero. One of my, the main part of my role is advising parents, new moms, on how to look after their child's skin. You see them, they're coming in, it's dry and scaly. What do I do, doc? Because it's very distressing to moms. And we talk about how to manage the skin. So there's no magical 30 number, no.
I love that.
Yeah,
I love it. You know what? I loved it when you said it starts in childhood. Apply that conscious and intentional parenting. Apply that sunscreen. Thank you for mentioning that. So tell me, Doc, I know there's also the element of making sure we stay hydrated. How much water should we drink to keep our skin? Because our skin is our major organ.
Yeah. So there is no evidence about water hydrating the skin.
Really?
When you drink The heart grabs its own, the brain grabs its own, the kidney grabs its own, and not that much. The skin is like last thoughts in the whole system, like, oh, okay, whatever, you know. The skin is almost like not much is absorbed. Now, I'm not saying you shouldn't drink, you shouldn't stay hydrated, you should stay hydrated. And as they say, the best hydration is when you drink to thirst and maybe a little bit more. So they drink 6 liters, drink 10 ounces, did all that. It's not completely steeped in science. Okay, the science is that you need to drink and to hydrate yourself. Because how can a woman that's 6'4" or a man that's 6'4" need 6 glasses, and someone that's 5'1" needs 6 glasses of water? If you live in the Sahara deserts,
I hear you.
6 glasses, and if you live in humid Lagos, you need 6 glasses. It's not possible. So it depends on how big you are, where you live, how hydrated you need. Our bodies know how to tell us when it's thirsty anyway. So it's part of our function, homeostatic function is called, to tell us when we need fluid. So drink to hydrate yourself. But there's not a lot of studies to show that water affects your skin.
Awesome. Thank you so much for clarifying that. Of course, people need to know that they still need to drink as part of also helping our gut. It's important. Yes. So tell me, when a young child, 15-year-old, comes to you and asks for Accutane? Accutane is very popular. Parents sometimes come in. Do you want to talk about that? Because I know that it has layers of tests that you need to go through. Who qualifies for Accutane?
So Accutane, depending on which country, Accutane in the UK is called Roaccutane. It's oral vitamin A. And before you get to oral vitamin A, you should have gone through the other steps of what of things to treat your acne with. So you should have tried the topical, like we talked about, glycolic acid, salicylic acid, there's benzoyl peroxide, there are combination retinol and antibiotics, all kinds. Then the next stage will be something like a pill or antibiotic tablet, depending on what's appropriate for your patient. And if that doesn't work, then the next step is Roaccutane. I don't start Roaccutane in my practice. I tend to leave that for the dermatologist to do. And what they will do is they will do some blood work and, make sure all the side effects that you can get, and they'll monitor people long term. Yeah.
Right, yes. I like that, because sometimes you feel a parent is more anxious about how her child or his child look, because I did have one time a parent that wanted me to start her daughter, and I know that Accutane has a lot of other side effects like birth defects or issues like that. I mean, at that age, they're not worried about that. But do you want to talk about birth control? Because I've seen when I have tried antibiotic on my patients, it didn't work. And of course, I did the topical. And then the next step, I suggest birth control. Sometimes I find parents are not open to that. What's the role of birth control in acne?
So it's like with every other medication. So there are studies that particular birth controls, the combined pills work. You have to take a history from the patient, know that they're not at high risk for developing issues with that, things like breast cancer and clots in the legs or the lungs. So you have to check all of that. But we would, as family physicians, we always consider patients' culture, beliefs, ideologies, and if the moms had a bad experience with birth control, or her religious leanings is that no, I don't want birth control, then we have to consider that as well. But having said that, many people consider birth control as well, especially when there are things they want to treat. So, for example, they've got painful periods. They're thinking, oh, I could treat my painful periods and I could treat my acne with more medication. Then why not? Or they've got positive experiences with the pill, then they would choose that. But that's an option to always discuss with the family. It's definitely on the table to be considered. Yeah.
Awesome. I like that. And then, of course, we have seen also men or older boys suddenly pop up pimples and then they come in. What is the relation there for men specifically? I would like you to talk more about how a car they just pop up these things
The oldest
later
patient
in life sometimes.
The oldest patient I've got now, like is actively
Right.
an issue now, is in his 60s.
Right.
Is a man in his
Wow.
60s. Is a man
Wow.
in his 60s who has had several rounds of Roaccutane.
Really?
Yes, several rounds of Roaccutane, and it's really funny because he wanted me to refer him back to the dermatologist, and I said, I know there's a waiting list. While you're waiting, do the following. And
Right.
when I got the letter back from the dermatologist, the letter was something like, he's much happier today compared to the times I'd seen him in the past. He told me you gave him some advice. So, like, goodbye to both of you. Whatever it seems, whatever you're doing is working, you know. So
Right.
it pops up. He's the oldest I've seen, to be honest. But I've had women in their 40s. I've had a woman that never had acne all her life.
Yes.
And this was 42 or 43, pop, that comes up.
Right. And I think mostly for those women, they are around the perimenopause and
Yes.
hormones, and they are approaching that menopause phase. Yes. Yes. You know what, Tanega, I know this time goes so fast. Tell me, do you want to share what have you been doing at your doctor's White Skin? And so that people can reach out if they want to check out your skin line. As I can see, it's working for you. You look amazing, by the way.
Thank
Do
you.
you want to share? Yes, before we close here, I would like you to share with our people here, our viewers, what few pop-up things that they need to remember when looking after their skin.
When looking after your skin, you need to cleanse. Find a good cleanser for you. A half hydroxy acid cleanse is good. A gentle cleanser if you've got sensitive skin. An enzyme cleanser if you've got sensitive skin and you've got hyperpigmentation. Those are good. Sun protection. If you take nothing away from this conversation, know that you need sunscreen every day. And the DYS one is perfect for you. If you're darker toned, for all skin color, actually, it gives you the protection. It doesn't leave you looking like a cast of Avatar. So that is amazing. We've got vitamin C serum that helps with hyperpigmentation, right? It gives you a glow. It helps with lines and wrinkles. And the powerhouse of skin care products, the powerhouse, retinol. Retinol is an all-rounder. It will help with acne that we're talking about. It's a prescription medication, so it helps with acne, lines and wrinkles, dark patches, you know. So look after yourself. This is what we present to the world. When people see you, this is what they see.
Yes.
So look after yourself. You're beautiful anyway, you know. So
right. Yes. You know what? Before we actually close up, do you want to talk about the people that do bleaching? I'll use just the layman's language, because some people, they say they bleach because they want to get rid of the hyperpigmentation. Is there any association of this with skin cancer at some point?
Dr. Makiwani, how long have you got? Why would you bring this up at the end? This is like my topic, my thing.
I kept it to the end because I wanted us to talk about this, because you see men and women, black women and black men, they're into bleaching. And so, it hurts me when I see that, and based on the fact that they want to be lighter. And I mean, our melanin, we are gifted with melanin, which is quite resilient. So I just want to know, do you want to educate really people to see the value of their melanin and how they need to preserve it?
Yes. So with skin bleaching is a really, really big topic. And in trying not to knock people's confidence, I'm saying, what is it you're looking for? What's behind this skin bleaching? Is it to be more acceptable by society? Is it to get a better job? Is it to find a partner? is it to get rid of hyperpigmentation? There are probably answers for all of those outside of skin bleaching. Also, you get this irreversible skin damage. So I told you melasma was hard to treat. Believe me, ochronosis, there's no one touching it. And that's the blue pigment you get when you bleach your skin for a long time from hydroquinone. There's no going back. That's it. Goodbye. You have to just cover it up with makeup for the rest of your life. So if you really want to talk about bleaching, just message me. Let's talk about it. I'll probably do a live at some point, which I've done loads of in the past. I've done loads of on skin bleaching. I will do it again because it seems to be like a recurrent thing that we need to keep talking about. Just find out why and see if those issues you're worried about can be addressed, because they're irreversible damages at the other end of skin bleaching.
Yes, you know why I'm bringing it? Because I know I want to come back with you here so that we can unpack it, because it has a lot of psychosocial presentations. Like you said, a lot of times people, they do it because they want to be accepted. Like one time I was watching a documentary of this one celebrity who literally goes bleaching like top to the bottom. And she says she really wants to be white like the acceptance like we're talking about. So sometimes it has something to do with self-esteem that, like you said, if you work on the cause of why do you want to do this. I like that approach, Dan. So tell me, just before we close, how do people find you?
On Facebook, Dr. Yinka Skin. On Instagram, Dr. Yinka Skin.
I love it. I love it. I love it. Actually, I watched one of your last shows. It was beautiful, showing all your products. Thank you so much, Dr. Yinka, and to our viewers. Thank you. I can see people are watching. Thank you for staying with us. We're gonna bring these discussions because the key thing is we wanna bring scientific-based stuff. So that's why I bring all these colleagues to talk about stuff and eradicate all the myths around stuff. And honestly, a lot of times it's what sometimes people read online. And not everything you read online is true, because it depends on the source, right? So it's very important for you to know who's the source, and always fundamental to talk to your physician so that you can get the good advice you need and the referral as needed. Thank you so much, Doc. I really enjoyed this. And of course, I know that skin bleaching is your favorite. I'm gonna bring you back. I didn't want to bring it because it's a big topic on its own. It has a lot of layers. Thank you to our viewers. You come back here same time, same day next week. I'll be bringing another speaker here. We're talking about everything: men's health, women's health, child's health, everything, sexual health, and of course, everything about what's going on in the world in terms of affecting our health. Mental health, we're not going to leave it. You know, it's my favorite topic. So I'll be bringing other speakers that will unpack some of these things. And again, thank you so much for staying with us. We'll see you again next week. Thank you so much, Dr. Yinka.
Thank you.